Hundreds of people have taken to the streets in the last week to protest a proposed redesign of the National Air Ambulance Service. If implemented, the changes would leave the Taupo, Rotorua and the Ruapehu districts without helicopter bases, meaning choppers would need to come in from Taranaki, Hamilton, Tauranga, Napier or Palmerston North instead. Now, following a meeting with the Health Minister, Central North Island mayors say the area is back in the tendering round for the rescue helicopter service. And the Minister, David Clark, is in our parliamentary office. Good evening, David Clark. Can you tell us a little bit more about that? Are these districts back in the game now?
Good evening, Rowan. Yeah, look, we had a really constructive meeting. The mayors brought to the table what I understand to be quite understandable concerns representing their communities. The truth is that their region was perfectly entitled to put a tender in all along. But that wasn't clear to the mayors, and those air ambulance services and trusts involved in the consultation that led to the design of the tender process were aware of that. But unfortunately the mayors hadn't been brought up to speed on that in a timely fashion. So it was a really constructive engagement. The mayors rightly expressed some frustration about not being in the loop on what was going on, and I pledged to make sure that they were in the loop because we all want the same thing, and ultimately we're all on the same page because we want better outcomes for patients, and that is what's driving this change. It's not a cost-cutting exercise. In fact, the upgrade of the fleet, which is now on average 29 years old, is likely to cost more into the future, but it will provide better clinical outcomes for patients across New Zealand.
There's obviously been some signal somewhere along the way that these areas are actually under threat, even if they are still able to be part of the tendering process. You know, how realistic are their chances of retaining the air ambulance bases there?
Well, look, the process is still underway. I can't comment on the decision making, but what I can say is that their tender, if they put one in, will be considered alongside others. They have to meet the clinical guidelines in their tender, just as any other tender put in would have to meet the clinical guidelines. There was a proposal that was put out there and it was interpreted a certain way in the media as meaning that some tenders might not be received warmly. That is a mistake, and those air ambulance services and trusts involved in administering the current services had a full understanding of what the picture was. Unfortunately, some of the mayors and other regional representatives hadn't been brought into the loop on that story, and they're rightly representing the concerns of their citizens, but they're also striking a balance because they want to see improved clinical outcomes over time for the citizens that they represent. I thought the mayors were incredibly reasonable. They brought a constructive conversation to the Parliament, and I look forward to keeping in touch with them as we work out how together we can ensure that New Zealand has a better air ambulance service into the future. I mean, the two key factors here. One is making sure those who are meeting patients have enough clinical hours behind them, that they're doing it regularly, and the second is that they are arriving in air ambulances, helicopters that have the clinical space inside to treat patients on the return journey in the best possible way. And that's the thing that affects clinical outcomes more than anything else, and that's what we're striving to get towards.
I guess the mayors told you about what it is about having helicopters in their areas that they see as very important. I wonder what you sort of personally think about that, having had that discussion with them. Would you like to see them stay in those areas?
I want to see the best clinical outcomes for patients. You know, I want to see more people avoid morbidity or mortality risks, and I think, you know, that's true of everybody. The clinicians that are involved in planning this process are of one mind that we need to consolidate over time and ensure that we're meeting clinical standards across the country. The last thing we want is some kind of postcode delivery of services as a country. We want to make sure that they're sustainable into the future. It is going to require investment. Remember that the average age of the helicopter fleet is 29 years. We've got to make sure that even the existing twin engine ones are replaced because they won't be serviced for parts in a decade's time. So there's a lot of planning gone into this, And the public need to be reassured, I guess, that the ultimate aim of this is to improve clinical outcomes for patients across New Zealand, and it clearly is not a cost-cutting exercise. It's about making sure that we're meeting standards no matter where we are in New Zealand. And the tender process is still open. No decisions have been made. When a tender comes in from that region, if it does, it will be judged alongside tenders from other regions.
Thank you very much. That is the Health Minister, David Clark.